Hello everyone, welcome back to the channel. So some of you may have often seen patients complaining of shoulder pain, especially while lifting their arm, reaching overhead or performing the daily activities. But how do we clinically assess which tendon or muscles are involved? So today in this video, I will demonstrate some of the most commonly used shoulder tendon special test, especially for the biceps tendon and rotator cuff muscles. In this video, I will be demonstrating speed test, Yergason's test, empty can test, then external rotation lag sign, and fifth is lift off sign. So let's see what is the position, procedure, and what a positive sign may indicate. Let's start with the speed test, which is commonly used to assess the long head of the biceps tendon. Patient is sitting or standing with the affected shoulder 60 to 90 degree of the forward flexion. The elbow is fully extended and the forearm supinated. Therapist standing on the affected side, one hand stabilizes the patient's shoulder while the other on the anterior surface of the lower forearm. Patient is asked to maintain the start position as downward pressure on the lower forearm is applied by the therapist. Next is the Yergason's test, used to identify a lesion of the long head of the biceps tendon. Patient sitting or standing with the arm in the anatomical position. Therapist on the affected side takes the forearm and flexes the elbow to 90 degree, leaving the forearm in the pronated position. The elbow is stabilized with one hand keeping the upper arm adjacent to the patient's side. The patient is asked to supinate the forearm and externally rotate the shoulder against the resistance. Pain over the bicipital groove or the abnormal movement of the tendon may indicate a positive test. Third is the empty can test, which is used to detect the presence of the supraspinatus tendinopathy. The therapist stands on the affected side. The patient elevates the arm to approximately 90 degrees in the scapular plane with the thumb pointing downward as if emptying a can. The therapist applies the downward resistance while the patient tries to maintain the position. Pain or weakness compared with the opposite side may be considered as a positive finding. Next is the external rotation lag sign, which is commonly used to assess the external rotators, particularly the infraspinatus and the teres minor. The therapist passively rotates the patient's shoulder in external rotation while keeping the elbow flexed. The patient is then asked to maintain that position after the therapist releases the arm. If the patient cannot maintain the external rotated position and arm falls back towards the internal rotation, this is considered a positive lag sign. And finally, there is lift off sign test to test for a partial or the complete tear of the subscapularis. The patient places the dorsum of the hand against the lower back. The patient is then asked to lift the hand away from the back while maintaining the internal rotation. An inability to lift the hand away from the back or significant weakness or pain during the movement may indicate the subscapularis dysfunction. So these are the 5 commonly used shoulder tendon special tests. But remember, no single special test should be used to make a diagnosis on its own. We should always combine the test findings with the patient's history, observation, range of motion, strength testing, palpation, and other appropriate clinical tests. If you are a physiotherapy student and want more videos on the special test, clinical examination, and practical demonstration, then subscribe to the channel, and I will see you in the next video. Bye bye.